All right, thank you so much. My name is Dr. Jemba Marpo Tenkoli, the Standing Committee Chairperson on Health, Wellness, and Social Development at the East African Youth Parliament. And I'm very happy to be having a discussion with the leadership of the East African Youth Parliament with me. Earlier today, we had a very phenomenal event happen, and they will be telling us all about it. But we're having a discussion around SRHR, adolescent SRHR services in the East African community. We've seen the growing age demographic in the region. We are seeing the numbers. When this is showing us quite a number of urgency in the needs to act. And the East African Youth Parliament is at the forefront of advocating for the key issues around for young people around the region. And this is why we're having this discussion. What is this East African Youth Parliament about? Why should we have it? And what are they doing anyway? So I'm very glad to, again, be hosting the leadership here. I'm going to have them introduce themselves, and then we can kickstart in a dialogue, a small discussion about something very crucial to the young people of this region. So I'll start with you. No, I'll start here. My closest neighbor. Could you kindly tell us about yourself, who you are, and then we dive into it.
Thank you very much, Dr. Jemba. My name is Magoba Emmanuel from Kenya, and I'm serving the 8th East African Youth Parliament as the clerk to the All Assembly. Thank you very much.
Very nice having you, Mr. Emma. Honorable Emma Maipai. Yes, right next to you. Could you kindly introduce yourself to us?
Thank you so much, Honorable Dr. Jemba. Eva Nganga Gerard from Tanzania. I'm also serving the East Africa Youth Parliament as a Deputy Speaker of East Africa Youth Parliament. Thank you so much.
Very nice having you, my right honorable Deputy Speaker, and I'm glad to have you on this talk show. To the very last guest that we're having today, would you kindly introduce yourself to us?
Yeah, thank you very much, Honorable Dr. Jemba. My name is Joa Sirahoza. I am the current Speaker of the 8th East African Youth Assembly. I'm glad to be here and to have this biversal conversation room. Thank you very much.
Very nice having you again. And I actually will start with you, Right Honorable Speaker, to your question that I think is very critical, that I think is very necessary. Over the region, we've seen we have quite a growing youthful population. And in there, we have a number of member states to the East African community that are committing to SRHR policies that are relevant to the needs of young people. We are seeing a movement towards creating a space that services to youth-friendly SRHR services brought to life. And my question to you would be, with all this, what is the gap that is existing? What are the political barriers? What are the structural barriers? What is limiting the different member states to implement these policies? What is limiting these member states to bring to life the needs that we are seeing despite the age demographic and the urgency in there? What do you think, according to your experience and your leadership in the East African Youth Parliament?
Yeah, thank you very much for that reference question. As you have said, it is true. There is a very demographic agency that is evolving within the East African community region, especially when we look at the issues that have to do closely with SHR policies, implementation, and especially to youth-friendly SHR services. When you look at the different national context within the partner states of the East African community, we dissect all these gaps that exist within the systems, or rather the structures of healthcare systems that have been in place in different countries. But these gaps have largely to do with political will, but also of the healthcare systems that did not truly allocate the bigger space that SHR services needs to own, especially when you have to do with adolescents' sexual reproductive health. So when you look closely at it, we are going to find that in some of the countries, we still have these issues very stigmatized. They are not considered something worth speaking about. They are not given even enough time to be discussed about in national dialogues or even at cross-border, conversations, because some of these countries have some cultural setups that believe that talking about sexual reproductive health is still a taboo. And the fact that some people still believe in those particular beliefs is going to always set back the improvement that is needed to be made, especially in allocating both the importance that these SHR services needs to have within these structures. So I'm going to give an example. Coming from a country like the Republic of Burundi, in our society or in our culture, we don't truly talk about sexual reproductive health so much, because it is in our culture that when you talk about this space, you are not considered as someone who has his mind right. So they think you have stepped out of the basic cultural conduct that you must have as a citizen. So, but it's not true, because even if they are not talking about it, our young people are facing issues that have to do address health services, and yet they don't have with the right information. And you are going to find out that because the government does not believe that this some of these issues should be discussed, the process is not going to be normalized. And this is going to hinder the country from addressing these key important issues, both on the political side and on the social side. So gaps truly are existing. No one can deny the fact that these issues are existing, despite the demographic agency that they are alerting within the countries given at the East African region level. So there is a need for something to be done in improving both the provisions of the SHR services for friendly centers that have to actually deliver these services.
Thank you so much, Right Honorable Speaker. And to me, I pick on the issue of the issues that are existing, especially in SRHR spaces. As the population, you've said, keeps on growing, we are facing quite a number of teenage pregnancies rising. We're seeing GBV cases rising. We're actually right now in the middle of the 16 days of activism against GBV. And we're seeing quite a number of issues, marital rape happening. And all these things happen, yet SRHR services are being, limited, or their structural or even political barriers that exist. Yet, truly, something needs to be done. So I'm really very grateful that, again, this is an issue that is central to a central point for advocacy, especially for the Youth Parliament of the young people of East Africa. And I think you raise quite powerful points there. And I will come to Emma here. Right, Honorable Speaker. Now, I've had the opportunity as the committee lead on health, wellness, and social development to have these discussions where, of course, you are part of, to have discussions around health, around financing, around the SRHR, even among many other things. And in our discussions, we've seen the issue of financing. We've seen the difficulties that are happening. We've seen the donor funding shifts. I think over the past years, we've seen the ODA finances cut down, the disease burden of Africa, raising up. But now specifically, there's something that bothers my mind. And it's something that goes to the Abuja Declaration. We've seen over 15% being called for different governments to invest that in health. Yet many governments do not do that. And this, this also implies or trickles down to SRHR services. So my question would be, again, we are seeing the donor shifts. What do you think would be those domestic financing modalities that we can employ to sustain SRHR services in our local different member states, but also giving us a broader perspective, especially on the East African community?
Thank you very much, Dr. Jemba. In Kenya, we refer to them as Daktari. So thank you very much. And I'll just speak it from the Abuja Declaration. It's about 10 years since 2015 when most African leaders met in Abuja and came up with all these critical issues on health. And they agreed that let's allocate 15% of our budgets to health so as to improve the health in our countries, because we all know that health is indeed a very critical issue. But 10 years since then, I don't think even if 5% of African countries have achieved this, the 15% allocation on health. And that is so bad. So coming to your question now, what African countries we can possibly do to ensure that we at least take care of our health without the donor fund and other money from outside. And this is actually visible in our lifetime. Today, just recently when Trump took over the leadership of United States, the other day, you found there were a lot of changes. He came immediately. It's either financial aid was cut short to most of African countries, and we've had a lot of side effects after his declaration. And you find that it's really an awakening to us African countries, and it's actually critical that we're having this discussion so as to save on our life to come. So it's so, in my opinion, it's so easy. I mean, some of the solutions, for instance, if African countries come up with possible national budgets that address specific health issues, 15% has not yet been achieved. The financial aids have been cut. It then takes us to come up with our own solutions to our own problems. And number one solution to the problem of health is simply ensuring that our budget are indeed rich to cater for the critical health issues. There is also issue of public-private partnership. The partnership between the public sector and the available private institutions such as NGO. And for instance, for example, what Faraja Africa Foundation is doing, you find that if other governments come possibly together and team up with foundations such as Faraja, it even gets easy for them to get to the local people, the local citizens of those specific African countries. And collectively, the government together with other private entities, they can easily narrow down to solving the solutions to the local citizens. There is also an idea of integrating SRHR ideas into the universal health coverage. I mean, this has been avoided by most governments. So I think it's very critical that our government also consider such issues, such matters, and implement them in their budgets. Include issues of SRHR, even into the health insurance policies. I mean, we have insurance for a number of health-related issues, but you find issues like SRHR, most governments do not consider such critical matters into their insurance policies. And I feel like that can be a very good entity to ensure that even that poor citizen who cannot get access to basic health facilitation can also be catered by the bigger national government. And lastly, my brother, I'll narrow this down to now our region, the East African community. Of course, our office represents the youths in East African community. So you find that it's also critical and very, very essential for these governments to come together as a region bloc and cooperate on matters such as SRHR to come up with policies, ensure that budgets are being allocated and followed. Actually, it is very critical that they come up with an accountability platform whereby we have representatives from each country in East African community that will be meeting either annual or quarterly to ensure that indeed there is a budget for this specific issue and it is being utilized to whatever it has been budgeted for. I think that way it will be good and it will help a lot in dealing with matters such as SRHR.
Thank you so much, Honorable Emmanuel. Wow, that is quite powerful, and truly I see that again, for anything to be implemented, for any activity to come to life, money is an issue, right? And you talked about insurance. We've here in Uganda, we've struggled over, I think, close to a decade now, trying to bring to life the health insurance scheme, which I believe is a very critical pillar to sustaining health services, especially for last mile communities. And while we talk about different services, especially in SRHR, we know that this is even worse for people in last mile communities. And the awakening of seeing how donors are shifting, the awakening of seeing how priorities are changing. And this should be something that we learn from and know that as African countries, again, we need to solve our problems. We need to innovate ways that we can finance our own solutions in the from the, of course, the member state level, but then as a bloc in East Africa. So truly, I do agree with you, and I believe it is if things ideas like this are brought to life and put out there, we know certainly we can see a great change, especially in impacting the young people of this region. So thank you so much, Emmanuel. Now my next question is going to be to Madam Speaker from Tanzania, and earlier today we had the privilege of presenting the policy brief on SRHR, demands and asks of the young people of East Africa, to the clerk of Parliament, to Yala, and it was quite a monumental occasion. It is a huge step, and now that drives questions of what should we expect. And I know young people are the biggest percentage, and they are the people that you are representing. Now, the question is, yes, we've put the policy brief there. What next? What should the young people expect? If you could tell me about that.
Honorable Dr. Jemba, as we have engaged the clerk of air today, we are looking forward also to engage more readers, such as the Speaker of the Air, and also other health committees, health focus committees, and other health. We will engage them so that we can implement this policy as soon as possible, and we are looking forward for the positive results. Yeah.
Thank you so much, Right Honorable. The other thing would be, maybe if I could push it to you, Mr. Speaker, how has this process been? I know the East African Youth Parliament, which of course I subscribe to, we sat earlier. Could you kindly maybe take us through how this process has been, and leading to this monumental occasion of presenting the issues that were discussed? Could you kindly take us through that?
Yeah, thank you. The process has begun in Arusha, where we had our physical official sitting. And part of the motions that we have moved, we have seen that a motion that had to be with SHR issues was a critical one. And because from the motions we had the establishment of the standing committees that are going to work closely in finding solutions to the issues that young people are facing, we had an opportunity to now start with the health committee, standing committee, of course, dealing with SRHR services, challenges within that same sector. So that's initially how it's been started, and we have a very active and very hard-working team from the health committee, standing committee, which is, of course, chaired by Dr. Jemba. He happened to be doing this conversation together. That sat together, and then together with the leadership, they have come up with a policy, a new SRHR central policy that has been successfully presented to the club, to Ayala. The process has been, I can say, satisfying, even if challenges do not list. But along the way, we are truly satisfied by the fact that now we know that the policy has been presented to the people whose capacity are going to shape the desires that we want to see implemented into practical solutions that are going to actually give solutions to SHR-related issues that young people are facing across the region. And I would like also to highlight that this comes as a practical answer to the diverse issues or challenges that have to do with SHR services provision across the region. Because you have seen that even politically speaking, we don't have SHR national policies which are aligned. Also, because if they are not aligned, they are not going to deliver the results that we expect, at least at a regional level. So the youth SHR-centered policy, whose brief we have presented to the crack to Ayala, is going to be the answer, the absolute answer we are looking forward to in order to make sure the solutions that needs to be provided within the East African Youth Parliament are actually in place with the people who have the capacity to make decisions in order to have the improved healthcare systems that provide these services.
Thank you so much. Thank you so much. And I'm very privileged that I get to be the chair of this committee. And for me, it's a huge fulfillment that the conversations we had back in Arusha, they have not been left in the rooms we were in. They are it's a reminder that the spaces being created are speaking to the needs. They're engaging with authority and really getting to a step of influencing. So I'm very excited, and I've been very privileged to host you and have this discussion about SRHR, but also from a committee lead's perspective, to have you who have been at the center of this process of drafting this policy brief collectively with the other members of the committee, that you share your perspectives, you share your opinion, you share the youth-centric view that you have around the region, especially in regards to an issue very critical like the SRHR needs of young people. So thank you so much. Thank you for giving us your time. And I'm going to ask you to give us just one last word, one strong last word as we conclude. And you can do it in a minute or two, and or three. I mean, this is a youthful conversation, so it would be nice to hear what you would like to tell the young people out there, to remind them what we're doing as the East African Youth Parliament, how they can be part of this movement that we are doing, of this great work that we are doing as a collective, group. And yeah, really, I'll start with Emmanuel here, next to Madam Speaker, and finally with you, Right Honorable Speaker.
Maybe as I conclude, allow me just touch a bit on what he mentioned on how the journey has been. Actually, it has been one of the most not so easy journey. Coordinating discussions between various East African countries located in various parts of this world, Kenya, Uganda, Tanzania, Burundi, Rwanda, all the network hitches, time difference, all those struggles. But at last we are here, having presented whatever we've been discussing all through over months to the clerk of East African community. And along the journey, we also appreciate the entities that have been helping us to coordinate all this. The Faraja Foundation, the Hivos, and even the IALA, the main East African Parliament. So you find that it has been a collective journey, and we hope it continues to be a collective journey. And my last word, it's simply a request to East African community that it is time we all join hands and together bring this home, the SRHR. We are speaking for the voices of a number of young people, adolescent girls, young men who are back in village, perhaps in Burundi, Kenya, Uganda, Tanzania, all those villages who cannot speak out for themselves, who feel so bad whenever they have all these issues, but they cannot speak out. They fear to be judged. So we are here talking for them. So it's just a clarion call to all East African community that let us join hands together, and together let us make this a success. Thank you very much.
Thank you. Honorable Speaker.
All right, Honorable Dr. Jemba. We thank the government of member state that through this policy that we are going to implement it together, and all the government, they are going to support to make sure that this is full successful, because we have the power that we want to end this HRA, the sexual reproductive human rights to challenges to end. So as youth or our club the leisure, so we have this ambition of ending. So we expect the government also to support and to reach at the point.
Thank you so much, Madam Speaker, and to you, Right Honorable Speaker.
Yeah, thank you very much. I would not have to say, Alex, I think they have really discussed about this particular SRHR services provision, and I'm very satisfied with the current results, the presentation of the policy group. What happened within the process is truly satisfying. Challenges have been there, but we are truly grateful to the people who were part of this. Starting from SRHR Foundation, the development partners like Hivos, but of course, with the dedicated team, starting from the office of the Speaker of the East African Youth Legislative Assembly, coming also to the Health Standing Committee, which is chaired by Dr. Jemba. We are very grateful to everyone who was part of this process. But I'm more grateful to the fact that youth leadership is no longer symbolic. We are now doing and actually delivering practical resolutions that are going to change the course of the young people's lives across the region. So I'd like to say a word of thanks for everyone who was part of this process, and we hope for the best. And it's not just like blind hope, because practical action have been in place and results are ready to show up. Thank you, Bain.
Thank you so much, Right Honorable Speaker. And I think this brings us to a close, but before we really close it off, I want to remind the young people of East Africa that the East African Youth Parliament is there to stand and represent the voices of the young people of this region. We are growing fast and we need each other. And the East African Youth Parliament may not reach everywhere, but we have representatives from everywhere. Find a way to interact with the different leaders of the East African Youth Parliament, to be part of the conversations you have with them, and let them know the different issues that we need to push. So we believe, especially now, speaking for the Health Standing Committee on Health and Social Development, we won't stop until the needs and aspirations of young people are brought to life. Today we start with a policy brief, tomorrow we follow up, and finally we bring to the realization and the needs and the asks that we want as young people of this region. Thank you so much, and I remain Dr. Jemba Michael Senkole, the chairperson of the Standing Committee on Health and Social Development. Thank you so much.